All right, let's talk about vitamin D. This is a big one that a lot of people miss, and unfortunately it's not quite mainstream yet, but vitamin D is one of the most impactful things you can do for your health, and I want to kind of talk about why that is. Vitamin D normally, well, it's actually not really a vitamin, it's a hormone. And normally you would get or synthesize vitamin D from sunlight. So sunlight hits your skin and you produce vitamin D. Vitamin D then in your body regulates a large portion of your entire genome. Over 1,000 different metabolic processes are dependent on vitamin D to actually work for you. It's a huge component of your immune system, of your skeletal system, of your digestive. I mean, it really just affects pretty much everything. The problem is most people are horribly deficient, and so that is something it's just too easy to fix. And too many good consequences or outcomes from that to pass up. So a couple things to understand. One, most of us aren't living out or spending much time outdoors, and so we're deficient that way. Also, as you get older, you're going to lose your ability to synthesize and produce vitamin D. So somebody who's 20 years old is going to have about 4 times the capacity as somebody who's 70. So as we get older, we have to, again, be more conscious of our vitamin D levels. Also, of course, the darker skinned you are. So even if that's just a really good tan, you're going to synthesize less vitamin D the darker your skin is, which is also why a lot of segments of the population are very deficient. So, Caucasians, even Caucasians, less than 30% of them have decent levels of vitamin D. In the African American population, less than 5%. And so, again, huge consequences to that. Also, with the vitamin D, if you're overweight, unfortunately, vitamin D is a fat-soluble vitamin, and so the bigger you are, the more your extra fat cells will actually kind of soak up that vitamin D, and you'll have less bioavailable vitamin D in the circulation. Which again increases your demand to stay at a sufficient level. So these are all some things to consider, and we could talk all day, but even just some simple Google searches can really talk to you about the whole list of positive effects there. One of the main things that I notice with people is they just feel better overall, and then again as their immune system gets where it needs to be. The people who get their vitamin D levels in check, they are the ones that tell me, Doc, I just don't get sick anymore. My allergies went away, my asthma, my kids used to have all these, once a month, every other month, a few times a year they get really sick, and it just doesn't happen anymore. So let me show you a little bit about what that looks like. I'll actually show you a chart here. In, wrong one. Okay, so this is actually a chart that kind of gives you a visual on the kind of what the research shows when it comes to vitamin D. And so right here across the top you have the serum level. You would get your blood tested for your vitamin D to know exactly where you're at, and you'd get a number. And that would be kind of what you line up with right across here. Now, vitamin D originally was recognized as the primary factor associated with rickets. If your vitamin D levels were just too low, you'd end up with rickets, disease of the bones, and that was a huge problem. In fact, such a big problem that they started fortifying common food with vitamin D. So you get vitamin D milk, and you get vitamin D kind of thrown into bread or whatever it is. The problem was they were really just aiming to prevent rickets. And so what they figured is if you could get about 400 IUs of vitamin D a day, then you'd get your blood serum levels about to maybe 20 or so, which is right here. And at that point, you'd pretty much avoid 99%. Pretty much every case of rickets would go away. We wouldn't have any risk or potential for that problem by getting everybody's levels there. The problem, again, is in a medical mindset, if we're just looking to avoid problems rather than maximize our potential, we a lot of times really miss out. And so as research has expanded and we've seen just how vital vitamin D is, we've recognized that as those levels go up, your potential benefits really increase as well in a number of areas. So look at this, very interesting. We go here, for example, to this green bar. Heart attacks in men, 30% of them are avoided if our vitamin D levels are at 35. Multiple sclerosis, big one, and a lot of times people just don't have any good treatment options given to them. I mean, here's one, just vitamin D. Simple as that. Make sure your levels are above 55, and presto, 54% of multiple sclerosis problems go away. Fractures, all fractures combined. This is, you may not necessarily worry about this on a day-to-day basis, but you wouldn't believe how big of a burden this creates financially for people on the medical system itself. 50% of those are gone when people's vitamin D levels are where they need to be. And that's actually because vitamin D kind of regulates the calcium absorption and your bone density. Type 1 diabetes, this big yellow bar. Again, notice that's type 1 diabetes, and 2/3 of that just gone if your blood levels are in the 55 range or so, and it just keeps getting better. Up here at the top, some of the most astounding data there is with cancer. So you've got breast cancer, 83% of it if your levels are at 51, 52. I just, you look at stuff like this and I can't imagine why anyone would have deficient levels of vitamin D unless they just didn't know, somebody wasn't telling them, and I can't imagine why any doctor wouldn't make this, a top priority. All cancers combined, this top one, best for last, as long as your calcium levels are, you've got sufficient calcium intake, which is pretty easy to do. If your vitamin D levels are at about 40, about 77% of all cancers combined are mitigated. And that is just astounding. Honestly, I'm not sure why this isn't all over the news, but we sure do our best to tell everyone about it and to just promote the idea that you should know what your vitamin D levels are on a regular basis. And if they are not at least in this 40 to 60 range, that you need to get them there. I like to keep mine right about here at 60. I think last time I checked I was about 61 or 62. And with some of our patients, we may even push that a little bit higher. Sometimes people ask about overdosing, and that's not really a concern. You'd honestly have to have a really horrible lifestyle and get your levels to 150, 200 before research would show any real downside, and that's just very difficult to do. Most people are coming into this with their level at 10 or 12, and so you're going to have a hard time really overshooting this by a lot. But the faster you can get those levels up where they need to be, the better. So how do you test? Pretty straightforward. It's a blood test. So a couple of ways you can do that. One, you can go to your medical doctor, and usually that's covered by insurance. You just have to, of course, pay your copay or whatever that is. You have to go see the medical doctor. You have to ask them for it. From what I've found that patients tell me, usually doctors are pretty open to that. But I would not just ask, I'd pretty much demand it, and if a doctor wasn't going to cooperate, then I would find someone else who would. Sometimes it can be difficult, and sometimes just inconvenient. So we actually have blood tests that we keep in the office. You can just pick these up, they're super inexpensive, and you just kind of do it yourself and send it in, and you avoid the whole rigmarole of having to make a doctor's appointment and wait around and get in there and do the whole history and whatnot, just so you can ask for your vitamin D to get checked. But either way works, and once you get that number back, let us know, and we can kind of walk you through how to get from where you are to where you need to be, what dosage for how long. And speaking of dosages, if you look at this again, remember the recommended daily intake was originally made up to help people avoid rickets. So what they found was that was about 400 IUs a day, which is practically nothing. And it's becoming more mainstream to recommend more than that, but we're still pretty far behind. So we like to keep people at about 5,000 IUs a day. That's just to maintain. Now everybody's a bit different, so we can test and we can see if maybe you need a bit less or you might even need a bit more. In fact, I have a genetic polymorphism that kind of impairs my ability to synthesize vitamin D, kind of increases my requirements vitamin D on a regular basis to keep my levels where they need to be. So everybody's a little bit different, but we'll start right around at that 5,000 IU a day mark. And then if you're low, we'll increase that for a specific time and a specific dosage to get those levels up and then retest and see where you're at. That pretty much covers it, but I will show you this other chart as well. Very interesting here for women in particular, especially as you're preparing to have kids, or maybe you're pregnant now or just had kids. Kind of a same setup here with the chart. So you've got your serum levels across the top, and you'll notice most of these are even, the numbers are even further down. So before you get into that 40 to 60 range where we were seeing all the benefits on the other chart, here on this one you'll notice, so starting at the bottom here, the children's outcomes, you can avoid a lot of these problems you may be worried about. So, asthma, kids with, having asthma, almost a third of them, you won't have to worry about that if you make sure the levels are, above 30. Lung inflammation, ear infections is a big one we run into a lot with our new mothers, and 25% of those. Common colds, how many of you would love to have for your babies to be sick a third of the time? And it's just get those levels above 31, 32 where they need to be, and you're there. Looking at pregnant women's outcomes as well. So preterm birth, 50% of that isn't a problem when your levels are at 40. So again, just a no-brainer here. Gestational diabetes, that's a huge concern, and especially women say, well, I had gestational diabetes with my last baby, so it's almost just assumed it's going to be that way for the next one. And of course, if you don't fix the cause of the problem, it very well may be. But looking at your vitamin D, if you don't know what your vitamin D levels are, or if they're low, well, of course we can expect these outcomes. What the research is showing us, it's very probable to start having all these problems. Depression, 40% of that. Women, pregnant women who are experiencing depression, very serious problem. But 40% of it doesn't have to happen if we just get our vitamin D levels where they need to be. Postpartum depression, 43% of it. And look at this, impaired muscle strength, 100%. So just some pretty fantastic numbers there. So again, I would encourage you, get your vitamin D levels checked. Either have someone else help you or grab one of the kits that we have, but you need to know where you are, and let us help you get up to a level that's ideal. And if you have any other questions, let us know. Light just went out, so I think that's it for me, but great to talk to you guys. That's vitamin D in a nutshell.